Hello, and thank you for joining this pre-recorded webinar on community surveying for dental health professionals. My name is Layla O'Day with the Oral Health Forum, and I will be your presenter. Today, we will cover the following topics. We will review what oral health community surveying is and why it's important that we identify resources that help connect our patients to care. We will also go over what some of the common barriers are that our patients experience when attempting to access dental care. We will look at resource mapping and why we at the Oral Health Forum follow these best practices to help set us up for success when we prepare to provide outreach services to patients and children and families that are in need of dental care. We identify resources that help the whole family improve their oral health and well-being. We will also look at some helpful links that will help us when it comes to surveying for resources and organizing those materials. A little bit about me. My name is Layla O'Day, and again, I work with the Oral Health Forum. I am a social worker, and I have been with OHF since 2017. I am from Urbana, Illinois, and I am a huge fan of the Fighting Illini, and I do bleed orange and blue. First, let's find out what we do at the Oral Health Forum to help kind of understand why we do these types of practices. At the Oral Health Forum, we have about 3 major activities. The first 2 being oral health case management and oral health education. Those services are provided directly into the community, and we reach a majority of who we serve are children in Chicago Public Schools, as well as their families and other communities in the area. We also provide oral health advocacy services where we participate at the local, state, and national levels to advocate for improved policy and funding that helps improve access to oral health care for our communities. Here's a picture of our team at one of our team outings a couple of years ago. We always try to take time to step away from the work if we can and enjoy each other's company outdoors. So when we are serving our communities, we want to help our families again get access to dental care. We want to help our families and our patients. We want to help everyone gain access to health insurance if they don't have it, as often that can be the barrier that's keeping them from getting dental care. We want to help our patients and our families improve their knowledge of oral health and help them practice help them practice the habits that help them maintain a healthy oral health habits. We want to help our patients and our families find a dental home so that they are able to, as part of their good dental hygiene practices, treat their oral health as part of their primary care, just like we would go to our physician for an annual physical. We want to encourage our patients to find a dental home and make dental care a priority just the same way. So in order to help our families and our patients do these things, we conduct community surveying so we can understand where we live and who it is that we serve. This is something that we do with every community that we serve, and it is the first thing that we do because we want to be prepared when providing our families with the referrals and the resources that they need to improve their oral health and gain access to care. We do these things to help our patients make oral health a priority and again, help them remove any barriers they may have to accessing dental care, as well as changing the conversation that oral care is primary care. Here we have a list of some common barriers to accessing dental care. This is by no means the full list of things. This is a list of very common barriers that come up and things that we often help our patients and families overcome to help them gain access to dental care and get that dental treatment they need. Often we'll find that our families have issues with getting care because of limited transportation services. And you'll find that often in rural communities where there's a lot of distance between where people live and where their resources are. And if a family or a patient is already experiencing challenges with low income, or maybe they have limited time or availability that they can see a provider, maybe the type of insurance they have isn't accepted by the provider in their area, maybe they are having challenges with navigating the system. By understanding that our families and our patients experience these things, we can then find the resources, we can then survey for the tools and the things that our families and patients can use to overcome these barriers and gain access. Community surveying, again, is about identifying the available resources that we have to help remove these barriers and make it as easy as possible for our patients, for our families, and our participants to get access to this care, reducing the steps it takes for them to get from where they are to completing their dental treatment, establishing a dental home, and having long-term good health outcomes. When we conduct community surveying, we're looking for things that are, again, going to help our patients get the dental treatment that they need to become healthy, as well as establish those dental homes. And so when we're working as community dental health coordinators, dental hygienists, public health workers, community health workers, whatever it might be, when we're helping families find a dental provider that can help them with completing any dental treatment they need, we need to know where they are. And so by doing our community surveying and looking in the area and identifying where the local providers are that accept Medicaid, who has sliding scale options, who can we send our patients to if they need a specialty service like anesthesia? What if my patient is only free on the weekends, like is the only time that they can go, or maybe they work on the weekends and they can only go at like 10 a.m. on a Monday. By surveying for the resources in our area, we can help our patients get there by looking at this information ahead of time. Again, we are doing this to help make it as easy as possible on our patients. We look into transportation services. As you see in the bottom left corner, we've got our toolkit buddy, and he's a friendly reminder to check out your Medicaid toolkit for resources that will help our patients with getting access to care. In addition to resources on how to apply for Medicaid and how to navigate Medicaid, there's also information on transportation services in there. Because it turns out that in Illinois, if you have Medicaid health insurance, you have access to transportation services to and from every health appointment, physical, dental, behavioral health, all of that stuff. And so what we did at the Oral Health Forum is that every year we survey these transportation services. We update the information, we document the information, and then we share that information to make it easier for you to make it easier for your patients. So again, there's resources like transportation services that we check and we vet that information annually. So that way, when we give it to our patients, it's accurate and we know that it's as up to date as possible. It's also important to see what other types of transportation services are available in your area outside. Perhaps your patient doesn't have Medicaid. What other options are there? In Chicago, we have a pretty good public transportation system. It isn't great, and especially it's great, but but in our areas where there's the greatest need, it's not great. And it's even more challenging for our families that rely on that type of stuff to get to care because there aren't as many providers in the area that serve with that reach patients that are low income and have Medicaid. So you see there's that kind of reoccurring kind of a catch-22 of a barrier with public transportation being low income, and then there being a lack of medical providers, Medicaid providers in the area. So by us knowing, how what other options there are, we can again continue to reduce those steps for our participants and make it as easy as possible for them. We also want to take a look at the local community and federally qualified health centers. They'll see anyone, regardless of insurance status, documentation, and they are located throughout the state. And there are links that there's a link that we will look at later that can show you how to identify those. And then you also want to be aware of where can my, patients go if they need help applying for Medicaid. Where is the local public health department if there's an issue with their application. So those resources are also available in your toolkit and are things that we do as part of our community surveying, because these are things that our patients may need when they're experiencing barriers. So once we have surveyed our community and we've collected all of this information about the resources in the area and what the community needs are, we take all that information and we map it. We literally put it into a map. So that helps us visualize what is and isn't in our communities, and where we need to look for extra support when helping our patients and our families remove these barriers. Resource mapping, it's a practice that helps us organize the information that we collect, and it helps us create a picture of the health systems our patients and families that are what they're expected to navigate in order to access care. To best explain to our patients and families the resources available and what to expect when they're navigating the healthcare system, it's really important that we understand what barriers exist, why they exist, and how we can break them down, helping, again, change the conversation that oral care is primary care and that everyone deserves access to dental services. As we prepare to map out our communities and resources, we want to organize ourselves. We often organize things by services provided. Sometimes we organize by location, by type of language they serve. We gather all of that information so we can stay organized. We also gather the information of other resources in the area. Where are the local schools? Where are the hospitals, food pantries, immigration services, housing services? These are all things that can create barriers to accessing care. And so we want to be aware of what resources are available in the event our patients are experiencing these challenges. We also have tools like Google, Microsoft Office, and our existing networks of partners, providers, community-based organizations, classmates, coworkers, partnering organizations like Oral Health Forum. We're all a part of that picture and are all part of tools that we can use to help each other. Google's pretty great in the sense that it houses most of where you can go to find information. We don't stop at Google. We still vet that information. We call the organizations and the dental offices, because not the information on Google isn't always accurate. And so we want to make sure before we hand our information off to somebody and expect them to use it, we want to make sure that that information's correct. That if they call somebody, that someone's going to answer. That if we refer them to someone who accepts their insurance, that's who's going to be on the other side of the phone when they call. So again, vetting that information and using the resources available to gather it. We also have here on the list Microsoft Office, and that's typically what's like on our computers. That comes with our computers as part of our organization. Not everybody has access to that type of software. It's not exactly cheap. However, Google has an excellent alternative with their Google Docs and their Google Sheets, all those different web-based services they have. We recommend those are great tools for organizing your information and also sharing them within your networks. So let's take a look at what does it look like when we're like stepping into the map, taking this information, putting it in, and understanding our communities. So this map here is an example of how when we survey and we're taking the information about who it is that we serve and then getting an idea of where they are, right? So part of community surveying is understanding where we live and who we serve. So this is an example. This is a map of the Prairie State College Dental Hygiene Clinic service area, which we have right here on this little purple star. These surrounding towns that are marked here with these blue markers, these are the top neighborhoods or the top cities that the patients come from that are seen at this dental clinic, right? So we worked with Prairie State College to say, all right, if we want to see where do we need to survey, where do we need to look and make sure we have resources for, based on where we know our patients live. So they ran a report of their patients, and these were the neighborhoods that the majority of the patients were from. So we took that information, we put it into this MyMap, which we'll show another example about that on how to do that in a moment. We put that information in here, and now we can literally look at where the clinic is in relation to where the people live that they serve. This is very helpful because this lets us know that, okay, if we have somebody come in who's from Monee and they get screened, they receive a referral, and they also tell us, we're having a really hard time finding childcare in our area, which is making it really hard to go to, these appointments. If we've already done our surveying, we can say, oh, we have actually some resources on childcare in your area because we won't have to say it like this, but we already did this beforehand. As preparing for doing our providing our services, we looked and said, okay, people from these areas are going to need access to resources. So as part of that, we're going to survey resources in this area, and then I can provide a referral that is specific to that person's need, specific to their location. So again, this is an example of how we can use our existing patient data to see where are our patients going when they leave the clinic, and where can we provide them with referrals that are closer to their home. Again, we want to make it as easy as possible on them. Here's another example of this. This is Malcolm X College Dental Hygiene Clinic and their service area. Again, we did the same thing where we looked at where were the top zip codes. So instead of by cities, this is by zip codes in the Chicago area. Where are the majority of the patients coming from? And a majority of the patients who go to the dental hygiene clinic at Malcolm X College right here live in these 6 zip codes, 4 of them being significantly further away from the rest of them. Why is this important to know? Again, for the same reason. If somebody is already traveling to a much further distance than other community members to get to the clinic, it may not necessarily always be easy for them to make it out to this area to get services. So if somebody's at the clinic and they say, we're looking for, we don't have any access to food, we're really low on food right now, we're looking for food shelters in the area or food pantries in the area. Because I've already done my research and seen that, okay, a majority of the people I serve live in these areas, I'm going to survey for food pantries in those areas so that if somebody in that area needs that resource, I already have it. So again, this is an example of using the information that we have to see where our patients live, so that way when we survey for resources, we look in those areas. And then we have this example of, again, this is an example of getting to know your community, and this is looking at the SIU, Southern Illinois University School of Dental Hygiene, and their workforce area. Now, in this exercise, we surveyed the 30 students in the cohort. This was from 2019, January in 2019, and we took down everybody's zip code. And so what of where they would be returning once they're done with school and they are planning to go back home. Where are they going to go and provide their services? So we took down all these zip codes and we created this map to get a visual and see that majority of the students are going to go back to either the Chicago area or stay in the Carbondale area. And then we've got a few that are, kind of on the cusp of here with Missouri, and then also a student who was from Tennessee. So this is helpful because it lets us know where uh, it lets us see where the workforce is going to, right? So we're looking at a class and we're looking at people who are studying to become dental hygienists that will be going back to serve in these communities. And so while we're in school, maybe we're done with school and we say, hey, I have a family that might need some help in an area that one of my classmates lives in. I can reach out to that person. So again, this is another example of how you can use this resource to plug in information and get a visual. Couple more examples on how mind maps can be useful. Here we have a list of the Chicago farmers markets from 2017. Again, I surveyed for the resource, I found it and I put it into into the map. And we use this as a resource that anytime that somebody was interested in finding a local farmers market, because often farmers markets have very healthy foods and they accept SNAP benefits, also known as food stamps. That's Supplemental Nutrition Assistance Program. So it's good to know where those are. And it's good to know to be able to see visually what areas have that resource and which ones don't. Finally, here's an example of when we surveyed two communities in Chicago. These are two different zip codes in the city of Chicago that we expanded our case management services to. And prior to providing our case management, we, as you can see here, surveyed for different resources in the area. These are some health resources. These are the schools that are being served by our team with the case management. And these blue teeth are dental providers. And what you can see here is that there's actually, a pretty big disparity between the amount of services within one zip code compared to the other. And because of what we know, because of the surveying that we did, we learned that this area here in red actually has the greater need, has a higher rate of oral disease than this one, yet it has fewer resources. So again, a nice example of why it's important to be able to look at this stuff ahead of time, because in addition to seeing what's available, you can also see what's missing. Here we've got some resources that will be helpful as you do your surveying and begin to organize all of your information. We talked earlier about finding the federal resources, the federally qualified health centers and community health centers. These are a really nice resource for, again, you popping in your zip code. I'm from Urbana, Illinois, so let's go 61801. Put in my zip code, and then it shows me which health centers are local to me. Now, if I want to look for something that is more specific to dental, we recommend using this Illinois State Dental Society resource. They have two searches on there that are particularly helpful when finding a dental provider and for when doing your community surveying. So let's go ahead and take a look at these. Now, again, this is very helpful for when you're doing your surveying, because somebody comes into your clinic, they're screened, they need dental treatment. Where do we refer them to, especially if they have Medicaid as their insurance? Well, we can use these types of resources to search in our area. So let's first take a look at the Find a Dentist resource. As you can see here, we've got powered by the ADA. Again, this resource is Find a Dentist. So let's use Carbondale as an example. We're going to go ahead and search for a dental provider in that area. And we want to look for one that has Medicaid. Because again, often that's a big barrier to why our families aren't able to get dental services, is because they're Medicaid recipients and there may not be a Medicaid provider in their area. So let's take a look in the Carbondale area and what we can find. So I'm just going to go ahead and type in here Carbondale, Illinois. I'm going to put in a search 50 miles distance. No specialty. I accept the terms of use. Let's go. Okay, so as you can see here, a lot of providers pop up. But we need to take it one step further because we want to make sure that we're looking for dental providers who accept Medicaid. So on this specific website, you've got to go to payment options to find that. This is part of that surveying process. Again, understanding how to navigate the system ourselves is very important. So it's helpful that we know that they have to make that additional step in order to make that search. So again, I'm going to select Medicaid accepted. I'm going to hit search. Medicaid, oh, I got to hit apply. And then I'm going to hit search. And then as you can see here, we've got the closest we have here in Mount Vernon. We do have an orthodontics. And then we have 2 providers in Mount Vernon. So before we would send this information to our patients, we would call and vet that information to make sure it was accurate. Is it up to date? Do we have, now this one, as you can see here, is Missouri. So that's not going to really help with Illinois Medicaid. And so that leaves us now down to the one in Mount Vernon. So again, now we've got one dental provider that came up on this search that accepts Medicaid. So what are our other options? So let's go back to the Illinois Dental Society page, and now we're going to check out their Find a Dental Clinic resource. This one's really nice resource for finding those federally qualified health centers that will see anybody regardless of insurance or documentation or income, things like that. So we go down here to click to view and interact with the map. And then here we are. We have the entire state of Illinois. I tend to, kind of just zoom in. Here I am in Champaign from Urbana. I like to take a look over there. But let's go down here to Carbondale. We'll stick with that example, right? All right, so if we look down here in Carbondale, we've got a few that are within the area. So let's take a look at what our options are. All right, we got the Shawnee Health Clinic. We see here they provide exams, x-rays, cleanings, root canals, accepts most insurance, including Medicaid, sliding fee available, and it includes their website. Okay, that is a lot of really good information. Here we have the John A. Logan College Dental Hygiene Clinic. If we go down here, you see that they provide cleanings, x-rays, and sealants. So if we're looking for a place that can provide treatment, so far this one is the best option. Let's take a look down here. We've got Rural Health Inc., General Dentistry, all private carriers, Medicare, and Medicaid. They also provide rural health discounts based on family income for those experiencing financial difficulties. So again, just there are some resources here. We just got to go in and take a look. So let's say, all right, we want to add this to, now we want to start creating a list of resources for people who are seen at the SIU Dental Hygiene Community Dental Clinic. At the SIU School of Dental Hygiene. Thank you. Sorry about that. So we want to go back and we're going to start putting together a map that starts housing some of this information for the SIU School of Dental Hygiene. So now let's check out My Maps powered by Google. Again, this is, you see, we've created a lot of maps over the days. We do these often to, again, visualize, see where things are, where things aren't, and uh, create new information and add it as it comes and as it goes. So as you can see here, I've kind of got already a drafted version of this, but let's start from scratch. Let's go ahead and create a new map. So again, we're just going to hit here, create a new map. And what we want to do is now we're going to, let's go ahead and title it SIU Community Dental Clinic Resources. We're going to save that. First thing I want to do is I want to, let's put in a layer. Let's do dental clinics. Again, all these, there's in your Medicaid toolkit, there are instructions and directions on how to do this yourself. So, I recommend hopping in and playing around with it whenever you get an opportunity. It's pretty user-friendly, and it's a lot like just using Google Maps. So here, I'm going to search up here. I'm going to do SIU Community Dental Center. Here we go. And now it just pops right up. I'm going to add it to the map. And I'm also going to personalize it a little bit. We got a tooth icon in here that I'm a big fan of. It gives us the opportunity to kind of personalize it a little bit. Okay, now we have searched and we have found the dental hygiene clinic and we have put it on our map. We can visually see it right here. Now let's we go back here and let's take a look. We had the Shawnee Health Service. I'm not sure about that Development Corporation piece about it, but let's go ahead and see what happens when we search Shawnee Health Service and add that here. Shawnee Health Service, Carbondale. And there we go. We can check and see if the addresses match. 400 South Lewis Lane, 402 South Lewis Lane. Okay, so then it would be, probably the next door over. So we just want to make sure that our information is correct or consistent. We'll go ahead and add that to the map, and then let's go ahead and give it something else too to give it its own little identity. Okay, so now I am zooming out, and here it is. We've added two things to our map. We've got the Community Dental Center, the SIU Community Dental Center, and then the Shawnee Health Department. And you can see that they are close to each other, and that is a good resource for referring our patients. So that is an example of how we can use MyMaps to house our information and look at the things that we have surveyed using resources like Google, the Illinois State Dental Society, to gather that information and then putting it in a way that is easy for us to understand, navigate, and use to refer our patients to services. You can also utilize resources like this portal for Illinois to apply for public benefits, abe.illinois.gov. This website, you can apply for public benefits. You can see if you're eligible. You can manage your existing case. These are things that people can do independently at home. This is something you can do with your patients. It's a very, very user-friendly resource. And then the Illinois Department of Human Services resources page houses all of this excellent information on different types of resources that our patients and families can utilize to help remove any barriers they have to achieving good oral health and good overall health outcomes. Finally, I offer this, again, as a reminder that Excel and Google, these are some of your best friends when it comes to searching, surveying, documenting, and organizing. And so we wanted to provide you with an example of what it looks like when we take our information, in addition to putting it into the MyMap and getting a visualization of where things are and where things aren't. We also organize our our information in a way that's easy to navigate to share with our participants as well. So staying organized and consistent is very important. And this is an example of how we house some of our information for dental providers. So that way we can give the best possible referral as possible to our patients. So now that we have all of this information on how to survey for information, how to collect resources, how to identify where resources are and resources aren't, what do we do with all this stuff? We use this stuff to help our patients get access to dental care. We help them coordinate their access to dental care. Don't forget to use the tools in your toolkits. Our Medicaid toolkit buddy, he is a good friend of ours, and there are a lot of resources in there in addition to Medicaid. And Illinois Medicaid resources about the transportation services and the MyMaps, the resource on how to use MyMaps is in there as well. Utilize your team, utilize your neighbors, your colleagues, your classmates, your friends, the partnering organizations, your neighbors. We're all in this together, and it's helps our patients when we help each other out as well. Don't be afraid to call us at the Oral Health Forum. We are happy to help you navigate as you help your patients navigate the system as well. And continue to follow those best practices of completing your surveying first, completing it often, and staying organized. Again, we vet our information every year because we want to make it as easy as possible for our patients to access the care that they need by making sure the information we provide them is correct. And go ahead, take some time to treat yourself. Thank you for taking time to participate in this webinar. And as you continue to soak in all of this information, begin to adapt it to your regular service delivery style and your professional development. As you serve everyone else, don't forget to take time to serve yourself as well and treat yourself with something nice. Thank you again for taking time to participate in this webinar. My name's Layla O'Day with the Oral Health Forum. Please reach out if you have any questions, and have a wonderful day, afternoon, evening, and morning. Thank you.